Hi, I will be talking about the autism biomarkers in schizotypy biomarkers in social anxiety disorders. Why are we looking for biomarkers? The adult psychiatrists, when they do have the wide spectrum developmental disorder, can they miss it, especially with the DSM-5, because DSM-5 underlined this fact. In the wide spectrum developmental disorder, they fuse the definitions, and the schizotypical characteristics are similar in adulthood and in childhood. Are we missing the diagnosis? So we started looking for biomarkers. And the second one, the mild forms of the autistic spectrum, they might come at the adult age, or they might have comorbidities, and they can come to us for a psychiatric service, especially in the healthy adults. There is a correlation between the schizotypical traits and the schizophrenia behaviors, and in the social cognitive problems, they are resulting from the dysfunctions of similar brain regions, and this is proved by many studies. That's why we started looking for biomarkers. Which social anxiety disorder patients, are we going to look for these biomarkers? And I will be focusing on the signs, the diagnostic criteria, the autistic characteristics at the adulthood, the genetic studies, the imaging studies, and also the updated studies, latest studies. I will be sharing this information during my presentation. In DSM-4 and DSM-5 diagnostic criteria, I put them in order because there are some changes, and I want to talk about that, especially in terms of social anxiety disorder diagnostic criteria. In DSM-4 and in DSM-5, there are differences, especially the social anxiety disorder, autism spectrum disorders, and schizotypic personality disorders. When we have connection between all of them, the talking, meeting different people, and they are also observed while eating, or the stage fear, they might come up in such situations. The anxiety and the fear can happen, and again, the communication problem is similar. And in the wide developmental problems, in DSM-4 there were different titles. They became autism spectrum disorder in DSM-5, especially the social communication and social interaction if there is a continuous insufficiency, and in the non-oral communication behaviors, again there is an insufficiency. Repetitive motor movements, insistence on being the same, and limited and fixed interest and dependency on the objects, and emotionally being under emotional or over emotional can be related to the autistic spectrum and also schizopathic characteristics. When we look at the adulthood autistic symptoms, the prevalence ratio is around 1%, and without getting any diagnosis, many adults can survive. And we can say that the numbers have increased recently because the social awareness has increased. And in the autism spectrum disorder, is there really an increase? In one of the latest studies, especially in UK, 9.8 per 1,000 is the ratio, and this ratio is similar in childhood, adolescent, and the adulthood. Therefore, this study shows us that there is no increase in the autistic prevalence, only the awareness level has increased. And in the adulthood, especially in the childhood period, if the IQ is 70 and above, and again till 6 years old, having 2 sentences, the prognosis is better, and they can have better language skills or social communication and interaction, and they are not going to be meeting the diagnostic criteria, and we can't diagnose those patients at the adulthood with autistic spectrum. Only major depression or the social anxiety disorders, we can catch them when they come to us with those problems. As the age gets older, the symptoms and the severity decrease and the stereotypic behaviors decrease. With the patients, especially noticed during the childhood, with the spatial education and with the efforts of the family, the limited fields of interest has been expanded. Therefore, the clinical examination is different in the adulthood when compared to the childhood. And Asperger's syndrome, I think I need to be mentioning about that as well. In the preschool period, it is commonly noticed in the preschool period, and that Asperger's syndrome is balanced during the rest of the life. Normally, they notice their self-situation and they can learn to understand the social signs, and they can get married, they can have children. So what happens, they start having an attention for the details, and they can focus on the fields of interest, but they can transform into a positive thing. Therefore, their success ratio in their career can increase, and they mostly prefer the engineering zone. Being self-conscious is making the youngsters to be incompatible with the society more difficult. They can have the good intelligence level and the language skills, but their social development is lagged behind their peers. Therefore, there are some psychiatric symptoms, cohabits, and the adults say that they can have easier trust, they can be prone to bullying, etc. They are more introverted, they avoid social environment, and anxiety and depression can be comorbidities in the Asperger patients. But schizotypal personality disorder is different, because these patients can have some friends and they can continue those friendships. When we look at the schizotypy personality disorder, non-decreasing social anxiety and the paranoid fears, I underline that, because they're interrelated to the social anxiety disorder. In the DSM-5, as stated by Levent Bey, the schizotypy spectrum, and in other psychotic disorders, we can see that. And in the diagnostic part, when we look at the empathy and the closeness articles, they have difficulty in understanding others' feelings and having damaging personal relations. These are important. And the beginning might be in the adolescence, and they need to be followed. And as the starting age of autism spectrum disorder is expected to be till 30 months old, and schizotypy personal disorder, we don't give the personality disorder diagnosis till the age of 18 years old, but the traits can start as early as 13 years old. But when we look at the social anxiety disorders, the symptoms generally start at the age of 14, 15, and up until 10 years, of period, the diagnosis can be given. And as the starting age, we know that they start at different ages. These three disorders, I want to show them all together because there's a close relationship between the three, especially when we look at their intersection. Interpersonal relationship difficulty is the most important part. Weak social skills, low abilities, but in the autistic spectrum one, their limited behaviors, and especially the problem with talking, and in the schizotypy personality disorder, both stated by Levent and Çağdaş Bey, different approach, limited emotional situation, repetitive thoughts and talking, and in the autism we see them in the behaviors, but in the schizotypy personality disorder we see that in the thoughts and the talking, and the social anxiety disorder is different from the other two because the psychobiological model is important there. Having a positive influence on others is clear, but because of the avoidance feelings they can't do that. When we look at the genetics, autism spectrum disorder and schizotypy personality disorder, the genetic biomarkers have been examined more in the studies, and the data gathered is more concrete. Especially in the autism spectrum disorders, many genes have been altered, both in the autistic spectrum disorder and in the social anxiety disorder. There is a common gene, Fragile X mutation, and the patients with Fragile X mutation, in their healthy siblings, they have been taken as the control group, FX-TAS gene in both of them. The positivity is high in both of them. There are various genes, but in the social anxiety disorder, neurobiological biomarkers along with them, behavioral inhibition, anxiety and introvertedness, and maybe these genes might be researched because not a meaningful gene has been found till now. When we look at that as a trait, we should look at the learning models, and the genes should be worked. And neuroimaging studies are indispensable if we are looking for a biomarker in the discriminative diagnosis. We need to be looking at them. There are many neuroimaging approach, but the methods are different, the diagnosis different, the number of patients, the stages, the ages are different. We don't have any standards. Therefore, schizotypy personality disorder and OCD and social anxiety disorder, we can say that there is no clear standard result. Each new study brings us new information and new data. There are a couple of definite points. As we all know, increased frontal brain volume. We see that in the autistic and again in the schizotypy personality disorder. Schizophrenia-like brain changes can happen. And in the social anxiety disorder, in posterior medial orbitofrontal cortex and thalamus, brain blood flow is increased. Last but not least, I will be giving you some data about the latest publications. In 2016, Patrick et al. Did it. Here, young adults who haven't come to the clinic. It is about the association of the schizotype, and personal traits were examined. Between November 2014, April 2015, 328 female and 88 males, and this was done at the university and with the forms, the short form, autistic spectrum form. There were 9 questions for the personality questionnaire, and autistic characteristics and the schizotypy scores, they are parallel to each other. And the interpersonal relations schizotypy points in the low and high group, they are similar. I think this sounds different because what is expected is to have that the interpersonal relationship points should be less with the schizotypy characteristics, but this study doesn't show that. Schizotypy point, if it is high, the interpersonal relations points are similar. And there is another study conducted in 2016, again among college students, the autistic characteristics, especially in these scientific researches, we can say that whether does it increase the success level. And this was conducted in the France, 194 male and some other males, and the average age is 21.
Otistik hem şizotipal özellikleri yüksek grup, düşük otistik özellik.
There is a high schizotypal and here in this study the data says that in group with high schizotypal and OCD symptoms, anxiety and depression levels are increased, and this is related to insecure attachment, and parent attachment is in both schizotypal and OCD things, and there is a deterioration in the parent attachment. Again, there is a study conducted in 2003, the relation here. There is a test called a test is conducted, autistic and schizotypal phenotype in the cross-section areas. There could be a relationship showing different spectral features. Actually, we cannot. There is an assertion stating that we cannot interpret them alone. In rotational test results, the social is the skills increasing, so social functions decrease with autistic communication is signified, and schizotypal this personality disorder is indicated. Another study shows that this schizophrenia features is codependent from the other features. The positive schizotypal features for low autistic signifiers is a marker. We are looking for markers. We need to look for the clinical markers, genetics and neuroimaging studies. We cannot access the data very quickly. So we need to look at the more significant clinical markers. And the positive schizotypal markers are signifiers for autistic symptoms. And in the differentiated diagnosis, we can count them in a positive schizotypal group if there isn't any paranoia in the patient. Their interpersonal communication is found to be very good. There is a study conducted in 2016. This is related to autistic anxiety and autistic characteristics. In social anxiety disorders, the eye contact time and frequency were researched, and as we know, there is an avoidance of eye contact in autistic individuals, and the interpersonal communication problems are very apparent. However, in this study, which is carried out with the adults, there is a goggle worn by the patients, by the participants, and this goggle measures the frequency of eye contact, the time of eye contact, and how much they avoid it. There is eye contact, and cutting the eye contact is a differentiated diagnosis symptom, and as autistic severity increases, they make better use of cognitive therapies, and this is one of the other findings of that very study. In autism, the avoidance of eye contact, then there is a delay in eye contact in autistic individuals in social anxiety disorder. The avoidance of eye contact is apparent with the more subtle clinical markers. We expect that the eye contact will be low. There is another study conducted in 2017 in affective positive male patients. There is a five-fold increase in OCD and schizotypal symptoms, and this is we see the genetic significant markers, and if there is in social anxiety disorder individuals, the deteriorations in their establishing communications is that there were 37 social anxiety patients, 27 non-social anxiety patients. So their low scale scores and autism spectrum scores are found to be parallel, and as a result of this study is more than 50% of this social anxiety disorder people they have the autism spectrum disorder. That as a result, but we see that the numbers are very high, and actually the autism spectrum scale should not be used for the scale, and there is it says that it should not be administered for the social anxiety patients. Okay, and there regarding the visual stimuli, so there are activities. The eye movements in face-to-face communication could be related to autistic skills. 27 female and 9 male students were taken into the study, and in autistic individuals, there is a decrease in eye discovery characteristics, and the high autism relationship can not be explained with the social anxiety disorder. The social anxiety scale was used in the study. The social disorder spectrum cannot be a guide for that. One last study I'd like to talk about is a study conducted in 2013. Again, the study is conducted in UK student population. As a result of this study, the social anxiety markers are social communication, social skill and communication, and social skill for male. And the shift in the attention are the markers for social anxiety. Last seconds I have done.